warm welcome and thank you to everyone for joining us today. Welcome to our webinar, Inclusive Cycling Cultures, a new global initiative to support cycling mobilities of care that we're launching today in partnership with the Bernard van Leer Foundation and our local partners in Mexico City, Istanbul, and Bengaluru that you will hear more about later. Just a few housekeeping things. For those of you who would like to listen in Spanish, the interpretation, the globe symbol at the bottom of your screen should allow you to tune in and hear everything that we're saying in Spanish. A big thank you and welcome to our interpreter, Cynthia. If you'd like to greet your fellow audience members today, you can put where you're calling in from in the chat so we can see who we have out there in the audience today. And finally, if you have any questions during the panel, please feel free to also put those in the chat. So to introduce myself, my name is Alex Baum. I'm the Program and Systems Manager here at Bikes and one of the coordinators of the initiative that we're launching today. A little bit about Bikes. We are an Amsterdam-based global NGO guided by the belief that bicycles transform cities and cities transform the world. And we envision an urban future in which half of city trips are by bicycle by the end of the decade. Our mission is to nurture, strengthen, and scale community-led cycling initiatives globally through a focus on what we call the human infrastructure of cycling, as we strive towards this bold vision that we call 50 by 30. We are excited to begin work on our newest global initiative in partnership with the Bernard van Leer Foundation, in which chain-breaking women, Purpose, and Bisi Tekas will play key roles as implementing partners. This new initiative follows the publication in 2020 of the report Cycling Cities for Infants, Toddlers, and Caregivers. Our aim with this initiative, based on the recommendations of the report, is now to focus on cycling awareness, education, and access pilot programs for women caregivers in different urban contexts, led by community stakeholders and providing key learnings for city representatives. Bikes will coordinate 3 pilot projects in Bengaluru in India, Istanbul in Turkey, and Mexico City in Mexico, working with local partners and cities to develop and test different types of programs and gather data on the experiences of women caregivers cycling in order to develop new knowledge products for city decision makers and advocacy groups and increase the uptake of cycling amongst the target groups. To give a little background, to date, there has been limited research conducted regarding the potentially positive connections between cycling, caregiver journeys, and early childhood development, leading to cities struggling to accommodate these groups' needs as they embrace cycling agendas. Shaping more inclusive transport systems, programs, and policies to support the mobility of caregivers is critical for their well-being and equal participation in society. And if the right conditions are provided for uptake, cycling could play an important role by providing affordable, independent, reliable, and energy-efficient mobility. In order to achieve this, caregivers, and women caregivers in particular, need better urban environments to cycle safely, as well as supportive awareness, access, and educational programs to feel confident and comfortable cycling in the city for care journeys. Speakers today will present their insights on the need to integrate mobilities of care in transport agendas, how to make cycling safer and more comfortable and more accessible for caregivers, and the potential that it holds for household journeys. We are excited that you've decided to join us today, and I now want to turn it over to our keynote speaker, Leia Ravensbergen, to deliver the keynote today on the topic.
Oh, hello, and thank you for that introduction. Can everyone see my slides okay, and can everyone hear me?
Yes.
All right. Well, my name is Leia Ravensbergen, and I'm a postdoctoral fellow at the University of Oxford. As you can hear from my accent, though, I'm originally from Canada, and I see there's at least 2 Canadians in the chat. So, welcome. And I'm absolutely delighted to be presenting this short keynote today, because I'm not only passionate about cycling in my research, but also I'm a passionate cyclist myself, and truly believe we can create a more cycle-friendly cities across the globe. I thought I'd take today to just introduce mobilities of care and what we know about it, and highlight the importance to kind of motivate us going into this wonderful initiative. So to start, what is mobility of care? The term was coined recently in 2013 from Sanchez de Madariaga. Mobility of care was coined as a counterpart to mobility for paid employment. And what it is the unpaid work carried out by adults having responsibility for children and other non-physical autonomous individuals, as well as those activities needed for the upkeep of the home. So in other words, what travel do we have to do grocery shopping, to run errands, to escort children, to escort seniors, to get to health appointments? That's all the work that's needed for care. What makes mobility of care particularly important in my mind is that it tends to be under-quantified, undervalued, and rendered invisible due to gender bias in the way that we gather, interpret, analyze, and visually represent travel data. So often these trips for care will be mistakenly considered for trips for leisure or for personal interests, or they're too short to capture, or they just don't get seen. And I think a good way of showing this is looking at typical travel surveys. For instance, this is an example of the travel survey that gets done in Spanish metropolitan areas. And this is the way it'll generally get represented. So we see here in yellow, we have the trips to work. In what kind of gray, we have trips to school. And you'll notice that there's no trips here for care because it isn't a category by itself. But if you're to break up those trips and put care as one category, and to really consider care in its own right, it actually makes up a massive amount of daily travel. That's 25% of trips are trips for care in this travel survey. And yet, if we're to look at that graph on the left, which is the graph that all the transport planners look at, we don't see how important care is. It just gets rendered invisible. So this is an example.
De cuidado, entonces es invisible.
My work in Montreal has shown the same thing. When we recategorize for mobility of care, we see that it's this very significant portion of daily travel. 28% of all trips in the island of Montreal are trips for care purposes. And yet we wouldn't know it if we were to look at the typical representations of travel data. So they are significant and they are important and they are ignored, and that's problematic. But they're not just that. Mobility of care are bound to be even more significant in our, COVID or post-COVID world. I think a lot of transit agencies are realizing, okay, people might not go back to the office at the same point as before. So how do we plan around non-work travel? Well, a big component of non-work travel is, of course, mobility of care. So they're bound to be proportionally more significant if we don't return to the office at the same levels that we were pre-COVID. So I hope I've convinced you, but there's more. It's not just that these trips are significant. There's also serious equity and sustainability considerations to mobility of care. The most studied one is the fact that women do these trips far more than men in a variety of contexts. For instance, this is data, again, out of Montreal. This is from my work, where you can see that women, which are represented by orange here, represent 32% of care trips compared to 25% of men's. So we see a gap when it comes to trips for work, where men do more, and for care, where women do more. So it's important to plan for care because it is women that are doing the bulk of these trips. And it's not just women, it's also low-income women. And sadly, we don't really have data on a large scale beyond just gender and income. It'd be very interesting to look into other aspects of identity, but they don't tend to collect those as well, unfortunately. But this graph here shows the distribution of care trips amongst men and women. So again, women in orange, men in blue, across income gradings. And you can see at the lower end of the income spectrum, we have a much larger gap in the proportion of care trips that women do compared to men. In higher income households, women still do more, but it becomes a little bit more proportional. So we have these serious equity considerations when it comes to mobility of care. But there's more. There's also sustainability considerations. And we know in a lot of contexts, and I know I'm showing you a lot of North American data, but we need to know more in other contexts as well. But care trips are predominantly done by car or by foot. This graph here shows care trips compared to work trips and all trips for different modes. And you can see that by car, almost 10% more trips are done by car for care. Walking is also more common for care, but where we really see where it's hard to do care is with public transit and cycling. Public transit in particular for work trips in the island of Montreal, almost 20% of work trips are done by public transit. Only 6% of care trips are done by public transit. And cycling, of course, which is, as I said, my passion and the focus of today, half the amount of cycling trips are done for care purposes compared to commute to work. So it's really important that we explicitly considered mobility of care when it comes to cycling planning, or at least I think so. But there's so little research on cycling and care. In fact, unless something was published very recently, the only academic articles specifically looking on cycling and care is a project that I did recently in the City of Toronto, looking at how we can have cycling and care done better, or people's experiences doing care trips by bike. And what you find is that we'll often think, okay, well, care is hard to do by bicycle because it often involves carrying things, children or groceries. And to some extent that was true. And in particular in the Toronto context, the idea of going with your children on a bike was considered something that was not appropriate and dangerous because the infrastructure just isn't there yet to be safe, feel safe enough to cycle with your child. For instance, I had a participant who told me, oh, I can't, it's very dangerous. And nobody I spoke to would be willing to cycle with their children. We also think of grocery shopping as a tricky trip to do by bicycle, but it really depends. It depends on the distance that you're going and how much you're carrying. If you're doing smaller trips, that can be quite easy to do by bike. And in fact, compared to other modes of transport, such as public transport, shopping can be easier because it can be quite direct to do by bicycle. You don't have to do transfers or long walks in busy parking lots. And then a final trip that we'll often talk about when it comes to mobility of care is trip chaining. This is where often, mostly women, but men as well, will often try to combine a trip, a care trip with a trip to work to have more plan the logistics of the day. So if you're dropping off your child on the way to work, that would be a trip chain. And again, that can be very convenient by bike as long as you have the infrastructure to feel safe doing that with your children, or you have the materials needed to carry the things you need. Trip chaining, bicycles give you that individual freedom and flexibility. So there really is potential to do this trip by bicycle depending on other circumstances. And I would argue that when it comes to doing cycling and care, we need a three-pronged approach to following social practice theory. We need meanings, so it's appropriate to cycle for care trips. We need to view transporting your child by bicycle as safe. We need to see the bicycle as a feasible way to carry home groceries. We also need materials. This is an important one. We need the infrastructure so that it is actually safe to do care trips by bike. And then you might need additional infrastructure on your bike to do care trips, such as children's bike seats or bike racks, saddlebags or panniers, baskets. Those kinds of items we don't all automatically have when we buy our first bike or when we try cycling in a city for the first time. And finally, it can take extra skills and competencies to be able to cycle with a child or to cycle with your groceries. You need to know how to do that. And those are kind of the three things that I think we need to foster moving forward to build a cycling city for mobility of care. So I hope the take homes, and I know this is short and that I talk fast, but I hope what you get out of this is that mobility of care is completely understudied, but we do know that it's very significant. It's bound to be even more significant in a post-COVID world. There's serious equity implications. We need to plan for mobility of care for women, and in particular, low-income women, and that there's serious sustainability implications. We know that these trips are harder to do by public transport and by bicycle, and I think it's really important that we foster cycling cities around mobility of care. And that is why I'm truly encouraged to see this initiative and honored to be part of a panel of people actually working on the ground to help make cycling for mobility of care more feasible. So thank you. And yeah, excited for all of this.
Thanks so much, Leia. Really great to have you here today and talking on this topic. I would now like to hand it over to Lucas, who will be leading the panel today. And we have a number of wonderful speakers as part of our panel. So I will pass it on to Lucas. Lucas, thanks so much.
Yes, thank you. Thank you so much for a great theoretical framing, Leia, and we're so happy to have you involved in the initiative. I'm Lucas, the Research and Advocacy Manager of Bikes and co-coordinator of the Initiative on Cycling Mobilities of Care with Alex. And I'm really delighted to introduce 4 speakers from a range of geographies and sectors that will join me, like Alex said, in a panel conversation that will explore the relationship between active mobility and more specifically cycling and more inclusive and livable cities for caregivers and young children. I do want to say that if you have any questions during the session, please drop them in the chat and I'll ensure that we can address some of those towards the end of the conversation. So I'll start by introducing our wonderful speakers and then we can get right into it. I'll start with Ivona Alfred, who is the program manager at the ITDP global team, responsible for content management and production on training materials, best practices, and visual content for their capacity building program. And notably, for the purposes of this conversation, Ivona was co-author on ITDP's great resource and relatively new report, Access for All, Access and Babies, Toddlers, and Their Caregivers. And we'll get into a little bit of the work developed there. So welcome, Ivona. Areli Carrion is a longtime bicycle activist and co-founder of Bisi Tekas, an organization that promotes the use of bicycles in Mexico City and lobbies for policy change around cycling and urban mobility. And since 2017, Areli has been involved with bikes as the local representative in Mexico City for the Bicycle Mayor program. Then moving on to Penina Ndegwa, who is the founder of WowMom Kenya. It's an organization with a mission to advocate for child-friendly cities by bringing to attention the antiquated policies that plague moms and children in cities, as well as provide factual, evidence-based information about parenting. And last but not least, I'm delighted that Andrea Maria Navarrete Mogolon can join us. Andrea Maria is a practical theorist cyclist, a cycle feminist, flaneuse, and social researcher. And Andrea Maria is currently the bicycle manager of the Bogotá Mobility Secretariat. She's also the founder of Mujeres Visibles, and in 2020 was selected for TUMI's Remarkable Women in Transport. So welcome all. I'm so glad that you could all join us in this exciting conversation. And I'd like to get right into it and ask Ivona, based on your research and experience, what are some of the unique needs and mobility characteristics of caregivers, babies, and toddlers in their neighborhoods? And how can centering active mobility in our city planning and policy support those needs?
Great, thank you so much for having me here today in this wonderful group, and really congratulations on the new initiative launch. So as Lucas mentioned, I'll draw some of the key highlights from the work on access that ITDP collaborated on with the Bernard van Leer Foundation. So cycling is really an excellent form of mobility for short and the medium trips for the mobility of care for caregivers, which means strategic and frequent trips to destinations and for purposes that respond to the critical needs of growing babies and toddlers. So these needs include quality nutrition and nearby sources of fresh food, also play and interactions in safe and healthy places, which are really critical for healthy brain development growth. And also there are healthcare services, daycares, and there's a number of supportive services within the community, as well as employment options that caregivers need. So we have to understand that caregivers' mobility is often influenced or even burdened by a number of factors, like taking care of other children, multitasking between employment and caring for one or even more children at the time or other family members, also needing to trip chain to multiple destinations as mentioned in the keynote, and also being time bound by frequent feeding and sleeping schedules. So these are all some of the really main characteristics that influence the travel. But cycling is also an excellent way of getting to know the world around for the little babies and toddlers, and also a way of spending time with their caregivers. And this is really a way through which they gain social and cognitive skills. So how urban environments, and specifically the neighborhoods, which are the really microcosms for families, how they are designed or made has a tremendous impact on the mobility of caregivers. So for example, whether there are safe walking and cycling conditions, are there places to safely park the bicycle near parks or daycares? Are there even destinations nearby where people live, so that short distances really support the daily mobility needs? And those distances really need to be short, right? Because caregivers move slower when they travel together with the young ones. So using this behavioral lens of the mobility of care is actually an excellent way for cities to plan active mobility, because increasing active modes really depends not only on the infrastructure, but how it interacts with the local environment.
Absolutely. Sorry, please keep.
So how it interacts, it means how it connects to other modes of transportation, how continuous the routes may be, how secure and safe the caregivers may feel, and how it supports the trip chaining, for example. So we talk about this interplay of land use and mobility extensively in the Access in Babies, Toddlers and Caregivers report, which culminates in the concept of 15-minute neighborhoods. And this behavioral lens really adds a meaning to the neighborhoods concept that many cities have been applying, given the fact that daily activities, routines, and the mobility are so localized for caregivers. So for example, I was recently visiting a suburban area, a county outside of Warsaw, where maybe just about 5 to 7 years ago, you would mainly see large roadways packed with traffic, where people would drive to larger, malls or city center to get to those essential destinations. And, back then cycling was just slowly starting, and now the county implemented a dense network of cycle lanes and playgrounds. So you would see caregivers and young children everywhere. And with that, of course, older people, youth, and able-bodied persons who also enjoy the active mobility. So in summary, the mobility networks need to work together with the environment and on the neighborhood and city scale. And the mobility of care is a great angle for good urban planning.
Yeah, thank you so much for those comments. And I think, I encourage everyone to check out that resource because it is, I think, a really valuable way of creating more livable cities for everyone. So I want to turn to Andrea Maria, because as the bicycle manager of Bogotá, which is known as a world-class cycling city, really kind of across the globe, I want to ask you, what are some initiatives that you are taking and that your city is taking to promote cycling for caregivers and young children?
Okay. Hello to all of you, to my partners, and thank you very much for this invitation. I think that the bicycle can play a key role in a sustainable and post-pandemic recovery, but to fulfill its potential, inequalities in urban cycling must be addressed, especially those related to existing gender gaps in transport. Since 2019, the City of Bogotá established a strategic program of gender equity and urban cycling, setting the goal of achieving gender parity in the use of bicycle by 2035. Currently, only 24% of people who move in bicycle in Bogotá are women. Also, Bogotá understands the need to prioritize care trips, and for this, it has launched a care mobility pilot with a focus on safe routes to school by bicycle and on foot. However, it is important not to neglect the other dimensions of care, such as of the health sector. This is crucial that there are safe bike paths to medical centers, hospitals, pharmacies, and other points to receive health care. But I want to highlight that we are working on the implementation of the first bike share system for Bogotá. It will be located between Usaquén and La Candelaria, and will allow easy connection with the public transport system, and will have at least 300 stations and 3,300 bicycles, of which the half of these bicycles will be electric bikes. 150 will be cargo bikes, 150 wheelchair with wheelchair accessories, and 150 bikes with seats for children. In addition, the system will offer the 20% discount on the rate for low-income population, 300 free bike repairs stands for all citizens, for all the city, in all the locations, and 30 managers to attend any situation on the road. Implementing the bike share system with a differential bicycle fleet has also allowed us to include care mobility in the user experience. This means that users of system will be able to take their children to school because they will find a bicycle with seats for children, and then to carry things safely, and shop and have a bike ready to move, all that. It means that people who are wheelchair users can also use the system through the wheelchair accessories. And it means that the elderly, for example, can move around in an electric bike. The area of operation seeks to generate the greatest potential demand for the initial consolidation for the system, and responds to the results of the survey of the clear preference carried out with the framework of the project's structuring. And what else we can find on our bike share system? Permanent quality service with bicycles in optimal conditions, permanent accompaniment of managers. Users should not invest in the maintenance of the bike or in the cost of the cycling parking, and save time by avoiding vehicular traffic. I believe that this project is one of the biggest bets for the mobility of care that Bogotá has right now.
Mm-hmm. Yeah, it's fantastic. I mean, whenever I travel to a city and I see the absence of baby seats on bikes, I'm always a little frustrated because that kind of isolates an entire user group. And so I think that yeah, not only the addition of baby seats and baskets and kind of mobility aids, but also cargo bikes is definitely a gold standard for bike share systems. So yeah, congratulations on that. And I want to turn to Areli now, because I think a critical part of also Leia's discussion was about creating those competencies and allowing caregivers to feel comfortable while cycling. And you've been directly working on the ground with your organization. And so I was wondering if you could talk a little bit about the Mamas Pedaleando Sin Miedo program, and why you think cycling, both personally, but also for the wider society, can be an important tool to empower those that are carrying out care journeys in their city.
Hello, everyone. Thank you, Lucas, and everyone. Yes, in Mexico, just as Leah and all my partners here have said, mobility of care is very important. It's in Mexico, around 90 million people do care or provide care to others. And 71% of those caregivers are women, which are mostly doing the job for free, without being counted, without being properly helped and visible, and having public policy to really help them to do these activities. So they are doing that on their own. They are just, assuming the cost of caregiving. So what we have done in Mexico City as Bicitekas is that we launched a program along with the Alcaldía Miguel Hidalgo, which is in the main center of Mexico City, to provide expertise or to provide a real training on women that wanted to carry children with them or cycle along with small children, how to do that properly, safely, and mostly giving women confidence to do it, because it must be said that women are doing it despite not having a wide network of bike paths provided to do so, or a proper road safety policy as well settled in Mexico City to care for them and their children. And they're doing that because of need, out of need, because there's not enough public service, especially on the peripheries of Mexico City. And women don't have the income to really afford other ways of moving around. So out of need, women are doing this already as they can. So what we are doing is, with this program, that Mamás Pedaleando Sin Miedo stands for Mommies Pedaling Without Fear, because what we want them is to feel more confident, to really know how to do this in a way that they can care for themselves and they can also care for their children. So what we did, which is also something that we've been somehow doing it along many years of working on the field, is that we use what we have learned in the bike schools that Mexico City and the civil society is doing for more than 15 years to provide those workshops to moms. It was intended for moms and dads, but actually only women showed up. Some dozens of women showed.
Pero decenas de mujeres se presentaron para aprender cómo hacerlo. Y como dijo, lo hemos hecho. Y
how to do it better, how to be aware of on things that maybe they haven't thought or they haven't learned from themselves through experience. So we saw that this is something that is very interesting and could be upgraded and could be replicated and upscaled. So more women are willing to do it, and as they do it, one thing that we've seen is that once women and children are doing it outside in the streets, they are somehow also pacifiers of the city, because then people look at them and say, wow, I want to do that, or I need to take care on the speed and some other risk factors on road safety. So maybe they are not intending to do so, but moms with children pedaling are transforming the city on their own, because they are, already, only by doing it every day, they are really changing how everyone behaves around them. So it's very important for the city to have these sort of programs and to scale them up to make it possible and feasible, and something that can help a lot of women. One thing that must be said is that in Mexico City, there's a longer, or in Mexico as a country, it's a wave of urban feminism. And now we have on our new general law on mobility and road safety, the caregiving, the mobility of care, already named and already there to be seen and to be counted. So I think we already have the understanding of the scope and the importance of mobilities of care. But I think we have a big opportunity to also use mobility of care and cycling mobility of care to address other issues as poverty, exclusion, violence towards women, difficulties to access income, and all this that we've been doing for some in pilots with alcaldías, with this small Mexican local governments, to really understand how cycling mobilities can really help, not only to move women around and move safely their youngsters, but also to address these other social challenges as poverty, inequity, global change, and all this that must be addressed urgently. Thank you.
Absolutely. Yeah, I mean, a terrific example And we will share also, I think there's been some great photos and learnings from that program. And what you say about kind of rendering visible those trips and those people is so key. And I think, yeah, Bisi Tekas and others have been, yeah, really at the forefront, I think, of demands for this kind of policy and programming. So, so that's great to hear. We've been quite, let's say, enthusiastic up till now about the positive and the potential benefits that cycling can confer, but there are challenges, right? And those were brought up by Leia. And I do want to ask you, Penina, through your work in Kenya, but also with your involvement with the UN Environment Programme at a regional level, what are some of those elements that are child-friendly and family-friendly that our cities lack? And how can we better start incorporating the perspectives of parents and young children in our work as planners and practitioners and policymakers and advocates?
Thank you so much, Lucas, for that question. For those who are not there, maybe during the introduction, I'm Penina Ndegwa. I'm based in Nairobi, Kenya, and I'm the founder of WowMom Kenya, a social enterprise that advocates for children-friendly cities. My passion for children actually started when I became pregnant with my daughter, because as an urban planner, I thought that this city would work for me. You know, I had worked for years just trying to make it work. But then it became worse the moment I became pregnant, because, you know, I don't want to walk for longer distances because I would get tired faster. Accessing public transport was not easy. And now upon considering some of my travel options, including using public transport, because then it was not even accommodating my travel patterns. And so I had to change everything that I needed to automatically use the car if I have to travel with my daughter. And I had to, even accessing any facility, like even if I'm just meeting up with my friends, one of the things that we would always ask, is the space child friendly? And there are those factors that we always consider. First of all, is the space, how do I access the facility? Can I walk, cycle, or for most of the time, like I mentioned, in Nairobi, I have to say I have never cycled with my baby because I love my life. I don't want to die because the cycle network in Nairobi is not connected, and it's basically not safe for a caregiver to cycle with a baby at the moment. Of course, we have some streets that have very good cycle network, but it's not continuous, and of course the speed coming is not provided. So for that reason, it's always very risky to just move around with a baby. And so what I've always done, and a lot of caregivers in Nairobi, especially the upper middle class, we stuck our children in the vehicles, and I don't like it personally. And the one particular time I personally decided to just test the public transport system, and my experience was that there's even no priority seating. Like I have to get into a matatu, what we call the public transport, and I have to figure out how I live in that I'm, you know, there's no indication that this is my space to sit. And for me, how I felt is that I'm really excluded. I cannot cycle in this city. Walking, I would say it's pretty okay for some neighborhoods, but not all of them. And now even public transport, I'm not able to use. Then based on the economic status of the country, not a majority of Kenyans do not even own cars. That means the lower income communities are definitely excluded from mobility, especially the caregivers. So as WowMom is first of all pushing that, you know, as you design your streets, you have to really think about the children. But going back to your question, you asked about what they need. First of all, children.
We seem to have lost Penina, whose internet was slightly choppy. So hopefully she will join again now in just a second. But maybe I can turn to you, Ivona, because I think you know, as we were bringing up these challenges, it's also within our sector, the articulation of care, its relation to urban planning, policy, and mobility are relatively nascent issues. And Benita, you're back.
Allow me to just have my video off for bandwidth. I'm so sorry. Yeah, so
No
sorry.
Please go ahead.
Yeah, so I was saying that cycling for me was not an option because of it's not connected, and public transport definitely not an option. But then thinking about what the children lack in cities, they definitely lack play facilities like Ivona had mentioned in her remark. We need, first of all, safe accessibility, because they have to either move around the city, that they're going to school, accompany their caregivers. They're part of the whole population, and they cannot be constant or just be locked up in one particular space. They're part of the urban system, and they have to move around. And then, of course, we have the need for play facilities. We definitely have amenities that the children, particularly the younger one, infants and toddlers, require, that most of the times when it comes to planning and implementation of programs, those things are omitted. In 2019, we undertook a research around access of baby changing facilities and how they actually affected how caregivers moved around with their children in Nairobi. And we noted that 84% of caregivers avoided traveling with their children just because they could, or avoided events and venues just because they could not access baby changing facilities. Of course, your WowMom is trying to implement that, and you're already rolling up the program. But that just shows that if a facility that a child requires is not provided in a city, that means they're not going to travel. That means they're excluded from the cities that they're living up in, and that means they're not able to thrive as the ordinary people would. And finally, sometimes I keep saying that as transport planners, we mostly think about streets as just for mobility, that even as we design our cycle tracks, we just focus on how people move from point A to B. But children are different. I work a lot with my daughter, and she wants to explore, she wants to run around, she wants to see the flowers, enjoy the cities, ask so many questions. But how we design our transport system, it's so boring for children. It's just gray and white, you know? How can we make it more attractive, more appealing for younger children to be able to enjoy the city? And actually, I've read a lot of Bernard van Leer work, and they have talked about the early years and the role that it plays in brain development. Over 80% of the brain will grow by the time a child is actually 3 years old. And that's the time, and all that is affected by how they relate to their caregivers and also the space that they're growing up in. So if we just design very boring cities that are just plain and no color, and they're just tall buildings, we're not thinking about that young child who is working with a caregiver in that street. We are affecting how their brain develop. And finally, so definitely we need to also we need to start considering streets as the biggest public space that can definitely be a play space for children. And of course, not just design a very good footpath and a very good cycle track. Children also need to rest. Even if there's a very good cycle track in a city, children will not cycle for 3 kilometers. They'll need to rest at some point. So we need some of those facilities that most of the time are not provided for, like benches along the walking and cycling corridors, just for caregivers to sit down and interact. We need baby changing facilities that they can do a quick diaper change if need be. And finally, on what they need, I wanted to talk about, of course, Ivona had mentioned this, like even daycare systems, because care is how a child interacts with their caregivers affect how and who they turn out to be in future as adults. And for most, like we have one particular project in Gikomba Market where we actually provided a daycare within the Gikomba Market. Gikomba is one of the largest markets in Nairobi. And those caregivers who are low-income mothers who have to travel with their babies to work every day because they cannot access, better childcare services. Of course, a nanny is too expensive. The daycare systems are unregulated and they're in a small crowded room. So those mothers have to travel with their babies every day. But now, where do those children stay the whole day? They keep walking around a very dirty market. And just providing such a facility has really transformed, and actually it's achieving what Ivona was talking about, the 15 minutes neighborhood, because those mothers live near the market, they commute to work daily, and now we have provided a space where the children can now be able to
play, interact with each other, and thrive in the space that they're growing up in. So that's my remark.
Absolutely. No, I think you strike several very compelling points, and also this prompts kind of a need to understand the holistic experience of being a caregiver or a young child in the city, and that simply promoting active forms of travel is not enough, and that we really need to think about it as kind of a pathway towards more livable cities with users with the most needs. And definitely cities with less cars are kind of a definite avenue for more active forms of living and dwelling and moving through the city. So as we start really kind of thinking about these needs in the way we transform our cities and our behaviors, I do want to ask you, Ivona, what you think needs to happen to kind of normalize this lens of care in our mobility planning for kind of the betterment of our work as planners, practitioners, policymakers, and activists?
So I think we really need to include all lenses and voices of all constituents in cities, right? People of all abilities and vulnerabilities, but especially this lens of mobility of care, as we know, it constitutes the majority sometimes of trips. So if people cannot come to us because they're busy caring for children, or they're preoccupied with multitasking, it is the obligation of the implementing agencies and decision makers to ensure that these perspectives and needs of different people, especially caregivers and women, are captured. So here the crucial thing would be participatory planning, including data gathering and monitoring and evaluation that really reflect those needs on the neighborhood and also the city scale. So the effective ways to normalize these perspectives are, for example, public campaigns and programs that help really shift the mindset of people, especially those who drive cars, and the people who really have a hard time accepting the fact that streets should really share the space for all modes of transportation, and that cities really can be a healthy and safe places for kids to grow up. So public programs can include car-free streets and days, and tactical urbanism projects that many cities have been pioneering. And just last week, I participated in the World Urban Forum in Katowice, where a couple of civil society organizers from Polish municipalities came up and shared how hard it is actually to organize a tactical urbanism project, or even a day activity where streets can be reclaimed from cars. So we really need to exchange experiences between cities, such as through ITDP Cycling Cities campaign, just making a plugin, and sharing good practices and empirical data are also usually more convincing to local governments. So I also wanted to make another plugin to ITDP's newest publication, making the economic case for cycling, and also tomorrow's webinar, where you can really learn about empirical data on benefits of cycling. And I think bikes also have been doing a lot of this kind of work, where the empirical data can be helpful for cities to understand what they can gain and what the society can also gain from implementing more cycling. And I'll drop a quick link in the chat.
Great, thank you so much. And yes, I believe the webinar is tomorrow at 3 p.m. CET. I intend to join that, and I'm looking forward to it. I want to turn to Andrea Maria, because as Leia also mentioned in her talk, mobilities of care are underrepresented due to the gender bias in the way that we gather, interpret, analyze, and also visually represent travel data. And you, previous to your current position at the City of Bogotá, was also a gender specialist, and a lot of your work has focused on this. We're using the term caregiver, which is a somewhat gender neutral term here, but as we were saying earlier, also the majority of women are carrying out these care trips. And I'm wondering how the City of Bogotá and how your team is moving towards articulating public policy with a gender and care lens specifically, and how that kind of goes through all of your work.
Okay, this administration issued the bike public policy. That is a guide to promote the to promote and guarantee the use and enjoyment of the bicycle in Bogotá. Its main objective is to improve the physical, socioeconomic, and cultural conditions for the city for the use of bicycle, and the public policy guarantees resources of 2.2 billion pesos for the implementation of bike projects until 2039. It has 5 strategic objectives in which 20 district entities work jointly, so that all the bike projects that are developed in the administration respond to the guide of the public policy. Today, Bogotá has this public bicycle policy, which projects from now to 18 years parity in bicycle use. Here, for every 3 men who moves by bicycle, there is a cyclist woman. I mean, the 76% versus the 24%, as I said in the question before. A gap that it's a call to action, as I said before. And for this, in Bogotá, cycle infrastructure must be built with a gender perspective. It must recognize that mobility of care is the main reason for women's travel, is the 46%, followed by work and study trips. That's why any cycle infrastructure implementation must respond to those travel needs. Also, it must work on road safety and personal safety. And for this, Bogotá has a protocol for the prevention, attention, and punishment of the gender-based violence in space and public transport that in the stage 4 promote strategies to prevent cases of harassment, and also tactical urban planning intervention. And I'm so sure that Bogotá will be will also be an example with the implementation of the bike sharing system with a gender perspective. That's it. It wants to supply through a bicycle system the needs of women in mobility. And finally, it is necessary to measure travel patterns, because today we know from mobility service, and it is a trend in America, that women are more dependent of public transport and women walk more. We have significant gaps in the use of bicycle, and it also necessary to measure the mobility of care and recognize that care work is assigned mainly to women, and transport system must supply it. And it will be very good if the transport system have differential rates for people, for example. And finally, that the planning of transport system ends the spatial and time tensions in how women leave the city, and with this improves access to opportunities and all the services.
Mm-hmm. Yeah, absolutely. Thank you so much for that. And so I think that, so there is a lot of work that needs to be done, right? And this is, I think, the purpose of also this initiative, that of course we want to promote access to cycling and to active travel for caregivers, but we also need to reflect as practitioners on our work and our ways of working at kind of different levels and different sectors. And so I you know, as we move towards starting to address these barriers, I want to ask you, Areli, having done some work you know, at the street level through community work, but also lobbying for policies at the national level, and really kind of having an overarching view on what needs to change so that we can make our cities more inclusive and our transport systems more inclusive. Where do you think we need to start to kind of address those barriers? Is it providing equipment, skills, more infrastructure, culture? I mean, all of these things, but how do we get started, I think, in your opinion, and how can we really start addressing those barriers?
As you said, we need a lot of things to change, and I would say everything has to change. Everything has to change. Where to start is a good question, because as you said, it's a mix of things that are barriers for women and also men caregivers to really start cycling and using this opportunity or this option for those mobility of care trips. Among women and who are doing the most, the majority of care trips, one key issue is not having the money to have bicycles. It's not owning them. is not having sufficient income to buy a vehicle. So that's one thing. Then some of them who already have them or have access to those bikes don't have the equipment, like the little seat to accommodate the child, or a basic, transformation of the bicycle, so they can carry some goods and greater loads, maybe both in terms of weight and volume. But mostly it's infrastructure. It's having ways and special safe spaces to cycle with confidence, no, without fear, without really fearing for their lives. And also it's a question of culture. Mexico is passing through a very difficult violence crisis against women. We have the awful championship of women being killed in Mexico, 9 of them every day. And this is something out of violence, of domestic violence and violence in the street. So we need to address those things if we want caregivers to being able to go and own the city, own the streets. And one key thing that must change is how we invest. How we invest on that. And I want to point the fact that many governments, I would say that this is happening not only in Mexico, but throughout the world, don't have money, or they say we don't have enough budget, or don't even have figured out that having a budget to this is something that they are considering, despite the fact that this is very cheap. I want to say this money must be allocated for helping mobility of care, but it's not a lot of money. It's really being able to understand how cheap and how cost effective it is. You invest a little money, and then that investment doubles almost for 20 times. If we see the numbers of a study that the World Bank did in Peru, every sol that was invested in cycling had a return of almost 19 soles so it's a very cost effective. I would say that's one of the most intelligent investments that are made in the city. So it's stupid not having the money, having this argument from government saying we don't have the money. And I want to stress the importance of this in Mexico, when we have an investment of nearly $50,000 million. Look at this number. $50,000 million subsidizing gas in order to make gasolines as cheap as possible. And they don't have money for cycling, for bicycles, for bike paths, for public spaces. This is unacceptable. This is unacceptable because governments have enough money, and they need to put that investment where it helps more people, and it helps on the long run, and it is an investment on the future, is an investment on the climate, is an investment on equity, is an investment against violence. So we need governments to start investing in these things. The thing is, many of them, they don't trust, don't know, and that's why it's so important to have pilots, to have on the ground experiences that can lead them to understand the importance of investing in this sort of mobility. Thank you.
Yeah, absolutely. I think it's a wonderful way to kind of bring it all together in this panel conversation. And yeah, a passionate call, I think, that we all echo for this kind of support at the government level. Thank you so much, all panelists, for joining us. I think, yeah, we can really see that if we start investing and supporting cycling and working towards cities that support the needs of caregivers and infants and toddlers, as the Urban 95 program of the Bernard van Leer Foundation has been kind of putting out, everyone will benefit. And so on that note, I'd like to turn to the final segment of this webinar, and we'll hand it back over to Alex, who will formally launch the initiative and also give some space for our partners to also introduce themselves. So thanks again all for joining.
Yes, thank you again. Thank you again. Thank you to Lucas for facilitating, and to all of our panelists for such inspiration, such interesting perspectives. Yeah, a lot to think about. So what I'd like to do now is talk a little bit about the program itself that we're launching here today. A very exciting day. And I think I'll turn it over to our various partners in just a second to talk a little bit about their work and their connection to the work, but just a little bit more information on this global initiative that we are launching today. So it will last a year, with most of the local implementation happening this fall. And we have sort of 4 key things that we hope to get out of this program, this project. The first is what I spoke about at the beginning, these awareness, education, and access programs that we will co-design, test, and implement in our partner cities, looking for increased local uptake from women caregivers participating in the pilot projects, as well as increased positive attitudes around cycling in their communities. The second thing that we hope to achieve is really incorporating mobilities of care into the strategies of the participating cities. So taking these pilots and really sort of achieving impact beyond the target group and really embedding this idea into the cities and really getting the commitment to scale this cycling education and access programs with a focus on women caregivers. The third is a new knowledge for policy brief and a toolkit that captures the best practices from this project during implementation and helps to increase the knowledge on the importance of cycling mobilities of care and providing tangible, implementable resources for both advocacy groups and city decision makers. And the fourth and final is the visibility of women caregivers cycling and cycling's potential benefits for caregiver journeys in cities, but also internationally, with this sort of early stage of setting up a community of practice made up of diverse urban stakeholders being established. So a lot of great things to come, a lot of excitement. We hope you will all follow along. So now to turn it over to our partners. The first partner I'd like to highlight is the Purpose Climate Lab in Bengaluru. A little bit on Purpose Climate Lab. Its mission is to accelerate and build the ambition of climate solutions around the globe. They support innovative climate campaigns and cultural interventions using an experimental approach, embracing failure as an opportunity to learn and innovate, and taking advantage of cutting-edge digital and communication strategies to achieve meaningful impact. Their work is rooted in this partnership with a wide variety of key stakeholders, ranging from local organizations to businesses to key influencers specific to the geographies that we engage in. So Gauri, thanks so much for joining us here today. Could you introduce yourself and explain a little bit about why this issue is so important to your organization and how it builds on previous work that you all have done?
Thank you so much, Alex. And good evening to everyone. It is about close to 9 here in Bangalore. I am in a state called Karnataka in India. First of all, I would like to thank and congratulate the team at Bikes and BVLF for facilitating this space and really like extending the opportunity to introduce care into conversations and efforts around mobility at large and cycling in specific. My name is Gauri. I am an issue-based campaigns consultant from Bengaluru in the state of Karnataka in India. In the past, I have worked on campaigns that have to do with environmental and civic problem solving, increasing the participation of women in politics, and over the last year and a half have had the immense opportunity to work with Purpose Climate Lab in India. It is my pleasure to be representing Purpose and our work here today in Bangalore, and I will sorry, that's my cat. I would actually like to start by speaking about the Bengaluru Moving campaign, one of the strands of work that Purpose holds very dearly is the climate work, and mobility sits very strongly under it. The Bengaluru Moving campaign started about 2.5 years ago, and is a sustainable mobility campaign with a vision to bring down the rising vehicular emissions in the city, with a specific focus on public transport and non-motorized transport. We realized through Bengaluru Moving that traffic congestion and vehicular emissions affect a wide variety of commuters, and they affect them differently, and that there are limits to the alternative modes of transport. What we also realized was that there is an enraged citizenry, but the citizenry is also constructive and proactive about opportunities and alternatives. This became the entry point for the campaign to essentially facilitate ways for citizens and local organizations working on or interested in working on sustainable mobility to actively and constructively engage. Through some of the ways in which that we've been able to do this is through citizen-led participatory planning, infusing public art and culture to promote walking and cycling, building pathways for young professionals from urban planning and other affiliated backgrounds to collaborate with active citizens and government agencies. But specifically to get to why we are here today, under Bengaluru Moving, early in around 2020, we ran a cycling education workshop series called Cycle School for Women. This came out of the multiple reflections shared by women commuters on what really stops them from considering cycling as a viable mode of commute. Some of the overwhelming and overarching sort of responses were that not having access to a cycle, lack of personal and physical safety in public spaces, many of which have been already spoken about by the panelists, gender roles within home where men and males have had access to cycles and cycling far longer than the women, and many such instances. So the Cycle School for Women was born out of an inquiry into what really stops women from getting out on the roads. Apologies for that. You can give me just a second. She's a bit hungry. And so essentially what we did was we did 5 cycle schools, and they were 2-hour workshops and across 5 consecutive weekends. And consistently with every weekend, we saw the demand in people who were interested in taking up these workshops spike, and to a point where we could not really keep up with the number of cycles and facilitators we sort of had arranged for each weekend. The youngest of whom was 7 years old and the most senior being in their late 60s. All of them having different reasons for wanting to pick up cycling. And we saw about 150 women actually come out through these 5 workshops. But what was more overwhelming for us as well was to see how over 100, I mean, I'm sorry I'm speaking in numbers, but like numbers somehow help paint a picture. About 100 of them with just 2 hours of training were able to walk away with it and walk away feeling they had overcome some sort of limitation that they were previously facing. Many of them went on to take up cycling either as a hobby or as a sport or as a viable mode of commute. And I think the option of being able to choose what you want to do with that particular skill is also extremely empowering. And we've seen that. So essentially, so we saw about 100 women actually walk out of those workshops, and we wanted to continue that engagement, and that's where this conversation on mobilities of care really came up. And it comes as a fitting extension of the Cycle School for Women and a continuation of the opportunity to really engage with these voices and their mobility aspirations. I'd like to spend just 30 more seconds speaking about what we really want to do in the short engagement on within mobilities of care. We're looking to work with urban young mothers through cycling education, as they have in the context of Bangalore, they're a significant interest group, and they have the interest and influence over decision making. Their stories and testimonials, one, will help us guide how to better engage with them, but also help us broadcast and take their stories to decision makers who really should be paying attention to the nuances that come from these stories. Ultimately, I think the star of this engagement for me, and I'm going to throw this idea out there, I hope that it really happens, but the women and children really occupying public spaces en masse to visualize this sort of idea that is quantifiable only when you really see them occupy that space. And I'm hoping we can acquire permission to have a DJ really lead this rally, because it's sort of a popular thing here in India where you, when there are religious processions, there's music sort of really guiding it, and there's thousands of people walking behind it. And I think it's something that we can hopefully co-opt for cycling as well. But thank you all for all of the insights. I think it really helped me understand what really care means in the different contexts, and to also keep an eye out and understand, be open to the stories that we're receiving, because the conversation is really new and there's much to learn. Thank you so much to everyone for the opportunity.
Thank you, Gauri. So inspiring to hear about the work that your organization has done and will do, and I hope the DJ thing does work out. That sounds really amazing. I'd now like to turn to our to the next partner we'd like to highlight today, Bisi Tekas. Bisi Tekas was born in 1998 with the objective of promoting bicycle mobility projects and non-motorized mobility that have a positive impact on the well-being of society. From the beginning, Bisi Tekas's rides, cultural activities, and campaigns have been used to promote the use of bicycles, but they are also oriented to demand public policies in favor of bicycles as a transportation option in the city and as a tool that contributes to building more humane cities. They were established as a nonprofit civil association in 2001 to promote the use of bicycles as a safe, healthy, and sustainable mode of transportation to, again, creating more humane cities. Areli, Georgina, thank you so much for joining us today. If you could introduce yourselves and talk a little bit about why this is important to your organization specifically, and how this builds on previous work.
Hello again. I might give out the microphone to Georgina, who is going to introduce what we have done in the past and what we want to do now with our newly acquired Bisi Catarinas, formerly Jump bicycles. But Georgina will tell you more about it. Georgina, hello.
Well, hi everyone. I'm Georgina. I am the chronic of Bicitekas. And I want to say that Bicitekas has been transforming the streets, the laws, and the Mexican society for 25 years in favor of road safety and more human cities, creating also documents to strengthen the civil society capacities, all of which are available in our website, bicitekas.org. Our collaborative and creative work achieve an update, the updating of the National Regulation 156 of environmental health in 2012, also the adoption of Mexico City first transit bill focused on road safety in 2015, and the recognition of mobility as a constitutional right in the first Mexico City Constitution in 2017. Along with Centrico, we created a successful strategy to achieve the recognition of the national constitutional right to safe mobility on 2020, and the latest approval of Mexico's General Law of Mobility and Road Safety in May 2022, in this year. In 2020, we saved 1,500 Jumps bicycles from being destroyed, and launch a project with $150,000 investments of Mexico City local government of Azcapotzalco. This program, called Azcapo en Bici, was the first free public bike service of Bicitekas and was very successful among women, but also revealed the lack of attention to the care mobility of these women and the poor supply of public transportation outside the center of Mexico City. With only 500 Bisi Catarinas, 687 users, most of whom were women of 35 years old, used the bike to take their children to school and their relatives to the doctor, and to buy products in the market, or work delivering products, or to commute to work. and report saving approximately 2,000 pesos per month. This is like $100 per month, or more than $1,000 per year. That is why at the end of the program in Azcapo, they approached to Bicitekas to ask for more. Mexican women move differently. They dedicate 21 hours a week to move, to take care of children and adults, compared to men who use Azcapo and Bisi that they report dedicate only 11 hours to these activities. We believe that for every woman who pedals freely, there will be less harassment, more opportunities for income and independence, less pollution gases, less noise, less congestion, and a lot of I'm sorry, my English, and loss of time in the transfer of all. That is why we proudly from part of this big pilot program to support cycling mobilities of care. And we are ready to collect data on women caregivers' experiences with our cycling, Bisi Catarinas, and develop new knowledge products for the city decision makers of Mexico City, and why not the whole country.
Thank you so much, Georgina and Noreli. It is so exciting also to hear the work that your organization has been doing for 25 years and plans to continue with the Bisi Catarinas. It's a great initiative, and we're really excited to work alongside you. So thank you for joining us today and sharing a little more about it. I'd now like to highlight Chain Breaking Women. Chain Breaking Women is a cycling women's solidarity group that began with a dream of helping all women become free, challenge all physical and mental obstacles, and reestablish the spirit of sisterhood that was lost. They are a community-led initiative teaching women to cycle and creating cycling activities for women to forge stronger community links. Hande, thank you so much for joining us today. If you could introduce yourself and talk a little bit about your organization, Chain Breaking Women, and how this initiative we're talking about today builds on the work you've done.
Hello, everyone. My name is Hande from Turkey, Istanbul. It's been really great to be there and to see so many women are actually working for a project like our project. It sounds like miracle. It seems like really we have some sisters around. So I want to share the screen if I can. Can I? It would be easier for me to...
Yeah, we can see your screen now.
Okay, this is us. We call Chain Breaking Woman. And we are all colorful in different age. We're saying 17 to 70 years old. All women are welcomed in our society. And these logos that you're seeing, that they're helper, and they're working and helping our project as brands and municipalities. Chain Breaking Woman actually born in 2019 in Istanbul, because the woman violence against women were terrible, and it gets as already told in I guess in the same in Mexico. In Istanbul, violence is getting bigger and bigger, especially during the pandemic. And as a Turkish woman, we felt like we can't do anything for other ladies around, and we felt that our strong is useless in this way. And government was terrible about this too. And we had a convention called Istanbul Convention, and in the beginning of 2020, they just canceled this convention, which was actually prohibited for violence against women and LGBT communities. And now we felt really alone and helpless, so we started these tours in the beginning. So story was really as exact it sounds like. We did a cycling tour and we were terrible on it, and we break the chain on the road. We were 3 ladies in the beginning. Then it suddenly, miraculously, it helped us mentally, physically, and we said it can help other ladies too. So let's do it, and let's just start a WhatsApp group. Then again, we add so many girls on the group, and we start giving some cycling lessons to each other. And then it stopped during pandemic. And we and some of my friends, we decided to do a project called Cycling Ambassador Program, which are the women, by the way. They're just women who do actually other works as a professional works, but they're helping other ladies, and they teach how to cycle, and they're showing a way to get out of their house, because house is a dangerous place for women in Turkey. So they had to be outside. Otherwise, we are actually just leaving the city, leaving the streets to healthy white men, and we don't want that. As you told before, cities belongs to everyone, especially women and kids. So we thought we should do something. And we did, by the way. In 2 years, we have educated 100 women, cycling women ambassadors, yay. And they can teach other women how to cycle with our methodology. And they know a little bit basic mechanic of bicycle. And we teach them how to be a bike-linked business projects and developments. How can be like, why they don't sell bicycles? It seemed like selling lemonade or something, but they think cycling is a big mechanical issue that belongs to men, so they were afraid of it. And we said, you could do anything. You can bake something and sell with bicycles, or you can, I don't know, you can fix bicycle. You can find so many things about your linked with bicycle. And we teach, by the help of the cycling ambassador, we teach 400 ladies how to cycle for free. And it was amazing. This touch between these all women were amazing emotionally. And we didn't stop there, and we teach 20 kids from orphanage. We call them chain breaking kids, by the way. They need us like we need them too. And we find 24 donation bicycles for them. We fixed it, and we teach bicycling to them with these donated bicycles. Now they call us cycling sisters, by the way, and we're still doing so many projects with them. So somehow it's not only a cycling woman plus cycling chain breaking kids project. And we're doing so much tours around cities, like, okay, from we are built and based on Istanbul, but we still doing other cities like around like Gökova, Kırklareli, Izmir. So these are like 2,000 kilometers such. And we are doing this cycling tour with women, some immigrant women, sometimes some with women with disabilities, blindness problems, whatever. So we are really, really diversity group, and we are loving it, because I think that's how women do. They accept everyone and they're just being perfect together. And we are finding some sponsorships for our tours too. And we are cycling, we are racing, another issue, because in racing sub-factory, like now I think there's a Tour de France, right? It should be. When you check all the races, you will see there's so less of women and so much men. It's a men's world, we know that. They were cycling forever, but now we are in the game, we always say. So we are trying to make even some women in these bicycle races too. So we're getting so much sponsorship to do that too. And we're of course doing some workshops and educations to all women. So our aim is we are trying to make a freedom for transportation for women. And of course, sustainable cities, because cycling, as you all know, is like solving all the problem of the planet. As Areli told before, governments are always asking, like, do we really need help in the cycling situation? But we are saying, if you help cycling, cycling will help you in all situations, economic situation, environmental situation, and everything as you imagine. So we are saying sustainable cities, but it's the only way. And we are saying, of course, empowering women mentally and physically, which is lost during pandemic, as all you see and lead these terrible, terrible times. And in the end, we are saying sisterhood, which was lost for years and years. Now we're feeling that we can make the solidarity during women. And this is our association center. By the way, we always saying we are accepted as members in the association, women and LGBT communities, because we don't care if you have a blue passport, whatever, green passport, whatever. If you're saying you're a woman, you're included in the group. So we are saying women and LGBT group owners. We have bicycle donations, as you see, and we are terrible in mechanics, but whatever, we are trying to find our best system. And we are saying we are breaking some chains. I know it sounds so harsh, it's so strong in the beginning, but we have 3 chains that we are speaking up. Chain of silence. We are breaking that. Women always say, as myself, talk too much, but actually we are talking less We are not talking about the real subject that we have to talk about, politics. The main objects about cities that we need to change and say something about it. So we are breaking the chain of silence, and we are breaking the chain of inaction, which is terrible for a woman. We see during pandemic, when we were inside the house, we were the victims of the violence, victims of the economic situation. We were the first one they actually think to just send from the work and do everything to us. So we want to break this chain of inaction and break the chain of loneliness. In Turkish, terrible to say, I'm so sorry to say, but there's an expression that you can't do it by your one woman head. If you have only one woman head, you can't do anything. It's a terrible Turkish, sentence. But now we are saying during cycling all together with all girls, we have so much heads, and you can't stop us with that. So we are breaking this chain of loneliness though. And this is the bicycle ambassador education. Okay, we're getting help from America called Get Women Cycling Association. And from Germany, we found these two supporters because we needed some methodological help, because Turkish government didn't really care about us in the beginning. So we had to find some international friends, and they helped us about education system. So we found this cycling ambassador system. We are giving them 2 hours of theoretical, 2 hours of practical, and 2 hours of bicycle mechanical education. And we are saying them, okay, you're ready. You can teach another woman how to cycle for free. You can be their sister, mechanical sister. And this is us. Okay, this is in the middle. This is all women who are teaching and learning in the same time. And we're doing these kind of tours. Sometimes we're cycling for wine, some cycling for, I don't know, any reason, just to eat some cheese around. So we are always finding a reason to cycle from somewhere to somewhere. And we are doing workshops and educations, of course. We found so many jobs for ladies who needs. We found so many bicycles if they trying to sell something with their bicycles, and everything about, okay, educational, economical, any kind of. And these are all perfect cycling kids, which they were in an orphanage before, and they were really not feeling that in a family. Now they're just calling us cycling sisters, so we're so great of that. And we are saying women belongs to streets always. So we are doing night rides. In Turkey, still, I hate to say that, but nights belongs to men. Women are not really feeling okay to go alone by themselves. So we said, okay, we have to get back the nights back. So we are doing night rides, especially night rides. And we are doing so much noise in the streets just to make this show. Another woman, as all you know, if another woman is making noise out of night, you're feeling safer. So we are doing this. We are making so much noise on the street. And we're showing them some women cycling movies and poetry nights, which is, we can ask always why, but we're doing it. We're making any events that can make women feel better. And this is, this is the racing moments. As you can see, we became the second, by the way, in the race. But you can see we are so happy to be second. So the first of the group is feeling like, maybe this being second is better than being the first. So I think this is the important thing. You shouldn't focus on the results, not the numbers, not the records. The thing is, you're feeling as a woman, cyclist woman in Turkey. That's how I feel in general. You have to own your voice, your thing, your access. So we were like that. That's a weird photo. So I wanted to share with you.
Hande, sorry to cut you off. We do have to close out the call. I'm so sorry to interrupt you.
Yeah, it was the last one.
Oh, great. I'm so glad. Thank you. Yeah. That was so inspiring to hear. I just want to close by saying one of the exciting things about this project is a global survey that we're going to be doing in partnership with Leia Ravensbergen, who gave the keynote speech in the Bernard van Leer Foundation team to better understand the mobility patterns and barriers of caregivers, as well as the preferred solutions to address these barriers. And we hope to use the results of this global survey to inform the policy brief and the toolkit that we mentioned to be released next year in 2023, and also to use those results in future studies. So please keep an eye out for that. We do hope to be quite transparent with the results of that survey. So please help us share that, and we will share share the results with you all. I just want to say one more time, thank you all so much for joining this webinar. If you felt this topic was engaging, please feel free to follow us on the channels that you see on the slide. Otherwise, thank you so much again and have a great rest of your day. Take care.